am Carmen Monge and this channel is MANO, the channel dedicated to all cancer survivors from around the world. This is a space where we share our experiences and we learn about this life after cancer. And today we are going to talk with Michael Holtz. He is a cancer survivor from the US that is going to tell us a little bit about him. Hi, Michael.
Hi, Carmen. So glad to be with you.
So the first question is, who are you? What are you passionate about right now? And what is your favorite food?
So my name is Michael Holtz. I live in Knoxville, Tennessee. I'm a 13-year survivor of stage 3B rectal cancer. And there's my dog. I'm passionate about my dog and about men's mental health in the cancer space, just helping men find connection and realizing they don't have to fight cancer alone. And my favorite food is pizza, unquestionably.
Who is that guy? Like the
This
one
is
behind you?
Marley. Marley is my 14-year-old golden basset. She's actually my cancer dog. She was a year old when we adopted her after I was diagnosed with cancer. I actually played the cancer card to get her. I've always wanted a dog. And after I was diagnosed with cancer, I said to my wife, Sarah, I said, I want a dog. I have cancer. We're getting a dog. And she was resistant, but she actually did the work to the research to find Marley. And we adopted her from a rescue. And the rescue ended up having an event close to our house. And as soon as I sat on the floor, Marley sat in my lap. And that was it. She was ours.
How was to have cancer in the US?
I am very much aware that I was lucky I was working for the American Cancer Society at the time that I was diagnosed. So I already had a leg up on most people, even though I was diagnosed at 43. When my doctor recommended that I get a colonoscopy, there was no fighting with the insurance company, and at the time, 50 was still the standard for screening for colonoscopies. There was no fighting. There was no having to argue with the insurance company. It was approved, and my care was amazing. My out-of-pocket expenses were minimal. But I know that I live in a state where there are a lot of people who don't have the same access that I do. I live in Tennessee. There are hundreds of thousands of people who don't have access to insurance, who don't have access to the same kind of care. And because they live in rural communities, their hospitals often are at risk of closing because of reimbursement rates. And there are a lot of people who, if they need to go to the hospital, it is a several hours drive. It is very difficult in some parts of our state to get adequate cancer care.
Do you know many cancer survivors, and how can you describe them in one word?
I know a lot of cancer survivors, unfortunately. Also fortunately, because you get to meet some really amazing people. And I would say a word that really describes all of them is fierce.
Side effects that actually you like about having cancer or about the treatment?
I joke about this, but so I sweat profusely and have since the end of my cancer treatment. And which is not always a good look, especially in the summer. I can walk outside of my house and look like I'm standing in the shower. Um, but because of that, I no longer have to do yard work. So I actually have a guy that once a week comes and does my yard work for me. So I don't have to get out there and sweat my butt off. I guess that's a good side effect.
And what is the stupidest thing that somebody have ever told you about having cancer?
The stupidest thing and a very hurtful thing is someone actually wished that I had died of my disease. It was a political conversation on Facebook, and I was talking about being graceful to other people and being grateful for being alive, and it was healthcare related. Um, and he didn't like my answer, and he private messaged me on Facebook and said that he wished colon cancer had killed me. But, I think that's part of our culture today is, people are keyboard warriors and they're willing to say anything because they're not connected to the people that they're talking to. And so we're not seen as people, we're just seen as bots or whatever on the other side of the screen.
Can you tell us a little bit about Men Up to Cancer?
Absolutely. So, Man Up to Cancer is an organization I'm very passionate about. We exist to help men find social and emotional connection during cancer, wherever they are in their journey. If you're a survivor, if you are a patient in treatment, if you're a caregiver to someone fighting cancer, Man Up to Cancer has a place for you because we build relationships. Culturally, we are taught as men, to go it alone when tough times. You're not supposed to cry and just all of those things. Men don't hug other men, just all of those sorts of, cultural expectations. And what we're seeing more and more is that's damaging to men's mental health. Man Up to Cancer has a community right now, about 3,500 men, primarily across the US and Canada, but also including guys from the UK and Europe and New Zealand now. And we have chapters across the country that help men connect in their local community or their state, depending on how big the chapter is. So, and we also do regional retreat, and we'll spend the weekend really having a summer camp experience. And my best friend and I were part of Man Up to Cancer. We actually met the year of the first gathering of wolves in 2022. We were inseparable for that whole weekend at Man Up to Cancer. And then he wasn't able to go last year because he started a clinical trial. And unfortunately, he passed away in December. Losing friends sucks, but it's also part of the cancer advocacy experience generally is the more people you know, the more people you're going to lose. I don't want to make that seem like a small thing because it's a big deal and grief sucks. And you and I both both understand that all too well. So we have a chapters program. We have about 50 chapters. We have the annual retreat, and then we do a chemotherapy backpack program. It's a really great thing. I love this organization, and we've seen that it's something that has been really embraced by the medical community and by the pharmaceutical industry. It's an amazing thing to be part of.
And the last question, but not the less important, which word describe you that you were like that before having cancer?
I think loyal is a word that describes me before and after. If you're a person who makes your way into my heart, I'm loyal to you. We are joined together. Whether that's as a friend or family member or, my wife who is amazing. I wouldn't be here without her, that's for sure. So yeah, it's loyal is definitely that word.
Thank you, Michael, so much for this interview.
Oh, thank you, Carmen. It's been a joy. Thank you so much.
Do you like this video? Give us a thumbs up and subscribe and share it with others. And if you want to tell your story, just send me a message. Thank you. Bye.